ladies and gentlemen, this is Professor Wagner again with an overview of the female reproductive system. What we're looking at right here, right now, if we orient ourselves, this is the anterior portion, this is posterior. What we're looking at right here, these are the fimbriae, which are essentially the almost like finger-like or frond-like structures that essentially are there to catch the ovulated oocyte as it's ejected from here, the ovary. Now remember, those are covered with cilia, and they essentially funnel the ovulated oocyte here into our fallopian tubes, as they're called, or the ovarian ducts. As we head down, you can see kind of the muscular outer wall of the uterus itself, surrounded by the perimetrium, which is kind of the serosal layer. What we see right here, this is actually urinary bladder, and this is actually the vagina itself. Now, if we look at the internal anatomy, just remove that. Here we see the uterus, outer wall. Remember, the outermost layer is the perimetrium. This pink layer here is the myometrium, which is the muscular wall, or the smooth muscular wall of the uterus itself, and that kind of red combination between the red and the flesh, or kind of tannish colored structures there, is actually the endometrium itself. As we head down through here, we can actually see the cervix would be this, and then what we see here is actually the vaginal canal, and the vaginal opening would be down here. As we look closer, once again, urinary bladder, you can see the rugae inside. Here we see the urethra. This is the labia minora, and then the labia majora. It's part of the external anatomy. Right here is the clitoris, and then up here you see this kind of mound of fatty tissue over top of what would be the pubic bone and the pubic symphysis. That's your mons pubis. Essentially, they're just kind of as protection and shock absorption.